How you doing, Mr. Carl? How you feeling today? My name's James. I'm going to be your nurse for today.
Nice to meet you.
What brings you in today?
Just feeling a little bit under the weather. Thought I'd come in for a checkup.
Okay. I see you're not really dressed for the weather today.
Yeah, it's a little chilly, but not too bad. I don't mind.
Can you say for me your full name and birthday?
My name's Carl DeGisi. I was born April 3rd, 1991.
Can you state for me the date?
It is December 2nd, 2014.
And can you state for me the current president of the United States?
Barack Obama.
Okay. Alright. I'm going to start by checking out your hair here. Making sure that the hair is evenly distributed, that there's no lesions and there's no patches of missing hair. I'm going to check your skull here, see if everything is symmetrical, there's no abnormalities, no lesions. Okay. Next we're going to check your eyes here. Can you follow this pen for me, please? Ocular movements are normal. Okay, we're going to check your eyes and your your pupils. Pupils are round and reactive to light. On the pupil gauge, they would be 2 in the light. Next, we're going to be checking out your ears. Ears are clear and dry. No lesions, no abnormalities. Ear structure is normal. Same for the right side. Ears are clean, no abnormalities. Okay, we're going to check your nose. Can you lean your head back? Nasal canals are clear, no abnormalities, no drainage, no current colds or sickness. Palpate your nose. Any pain there?
No.
Discomfort?
None.
No. Okay. You're going to open your mouth for me, please. Okay. Lips are moist, no cracking or bleeding. And the mouth is moist. The mucosa is moist. Teeth are intact, no missing teeth. Tongue is moist and dry. Tongue is moist, excuse me. Palate is intact, no abnormalities. Uvula is intact. Okay. Can you stand up for me, please?
Yep.
All right. Check that your trachea is midline. Trachea is midline. Thyroid is not swollen. Next, we're going to palpate your lymph nodes. You can sit down. Next we'll be testing cranial nerve 1. Can you smell that and tell me what it is?
Banana?
Banana, yes. Cranial nerve 1 is intact. Next we will be going over to the Snellen chart over here. Can you follow me, please?
Sure.
Can you start by closing your right eye and reading the highlighted?
Starts with D, E, F, P, O, T, E, C.
Okay, can you cover your opposite eye and read it backwards, please?
C, E, T, O, P, F, E, D.
Okay. Right. You can go sit down. Cranial nerve 2 is intact. Next we'll be testing cranial nerves 3, 4, and 6. Can you follow this pen for me, please? extraocular movements are normal. I'm going to recheck your pupillary response. Pupils are round, reactive to light. Can you follow the pen? Eye convergence is normal. Next we'll be testing the trigeminal sensation. Can you tell me when, close your eyes and tell me when I'm touching your face?
Now. 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 Now.
Next, can you clench your teeth for me? Okay. Next, I'll be testing your corneal reflex. Okay. Corneal reflex is normal. Next, we will be testing facial motor activity. Can you smile and frown for me, please? Okay. Can you clench both eyes closed? Okay. Can you puff out your cheeks? And raise your eyebrows. Okay. Cranial nerve 7 is intact. All right. Next, we'll be doing the Weber test. We'll be using the reflex hammer as the tuning fork. All right. What I'm going to do, Carl, is I'm going to activate the fork and put it on top of your head. And it'll be conducting through your bone and telling you whether or not you hear it in both ears.
Yeah, I can hear it in both ears.
Okay. Next, we'll be doing the Rinna test. What we'll be doing is I'll be activating the fork and I'll be pushing it against the bone behind your ear.
Okay.
And then next I'll be reactivating it and tell me whether or not you hear it louder off the bone or on the bone. Okay.
Is louder on the bone.
Okay. I'll do it on the other side.
It's the same on the bone.
Okay. Next we'll be doing the Romberg test. Can you stand up for me, please?
Yep.
Can you close your eyes and put your arms out? Okay. Cranial nerve 8 is intact. Patient is able to balance himself with his eyes closed. Okay. You can sit down. Next we'll be testing cranial nerves 11 and 10. Can you say ah for me?
Ah.
Okay. Next we'll be testing the client's trapezius and sternocleidomastoid strength. Can you turn your head to the side on both sides? Front and back. And can you resist? Okay. Next, can you protrude your tongue, I guess, and move it side to side? Okay. Cranial nerve 12 is intact. Next will be auscultating the client's carotid pulses. No abnormalities, no bruits. Next we'll be palpating them. Pulses are strong on both sides. Can you open your mouth for me, please? Close. No clicking present on opening and closing of the mouth. Okay. Can you raise your shoulders out? Right now we're going to test your strength. Can you resist that? Okay. And then can you like that? We're seeing your range of motion. Range of motion looks good. All right. Next we'll be taking your vital signs. Client's blood pressure is 122/78. We will be using the Penlight as a thermometer. This is going to go under your tongue. Okay. Client's temperature is 98.2 degrees Fahrenheit. Next we'll be checking your pulse from the radial. Client's pulse is 72. Simultaneously, I was able to check his respiratory rate, which was 18. Carl, are you feeling any pain today? From 0 to 10, 10 being the worst possible pain.
No, I'd say 0, no pain.
Okay. Next, we'll be listening to your heart sounds. We'll be starting at the aortic, which is the second intercostal space. Next, we'll be moving to the pulmonic. Which is at the second intercostal space. And then the tricuspid at the fifth intercostal space. And the mitral at the fifth. Client's PMI is at the fifth intercostal space. S1 and S2 sounds are heard. There's a normal rhythm and rate, and there are no presence of any murmurs. Next, we'll be listening to your lungs. Can you take your shirt off here? Respiratory rate from vitals was 18. Okay. Now we'll be listening to the anterior lung fields. Can you take deep breaths for me in and out through your mouth? Lung fields anteriorly are clear. Next we'll be listening posteriorly. Deep breaths. Okay, can you stand up for me, please? Step forward. Can you take a deep breath for me? Okay. There is symmetry of the chest wall movement while breathing. Okay. I percussed the posterior lung fields and no abnormalities present. You can sit down. Okay, let me see your hands. I'm checking for any edema, discoloration. Temperature feels warm. Cap refill on right hands is normal, less than 2 seconds. Skin turgor is normal, returns to normalcy very quickly. No odors or any lesions present. Let me just check out your nails. Nails are clean, cut short, no infection present. Nail beds are clean. Let me see this side. You turn your hands open like this. I'm going to check both your radial pulses. Radial pulse is strong. Next I'll be checking your brachial pulses. Brachial pulse is strong. Can you keep your arm out like this for me, please? And resist my pulling. Now I'm going to push. And do it on the same side. And pull. Push. Okay. You have full range of motion with your elbows. Okay. Next we'll be testing your wrist range of motion. Back and forth. Any pain with that?
No. No pain.
Okay. Grip my hand. Strong grip on the right. Strong grip on the left. Okay. Now open your fingers up like that, and I'm going to resist. Finger resistance is strong. Next we'll be testing the biceps reflexes. Bicep reflex present on the right. Biceps present on the left. Next we'll be doing the tricep. Rest your arm on my arm. Triceps reflex present on the right. And present on the left. Next we'll be doing the brachioradialis. It's present on the right side. And present on the left. You put both your arms out and relax them. Okay. What I'm going to do next is going to do light touch and deep touch.
Okay.
You got to tell me which is which, okay? Close your eyes.
Light touch. Deep. 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 Light.
Okay. Next, I'll be testing to see whether you can determine between sharp or dull pain. Close your eyes and keep your arms out again.
Sharp. Dull. Dull. Sharp. Dull. Dull.
Okay. That sensory function is intact. Next, I'll be giving you an object and you have to determine which it is, okay?
Okay.
Close your eyes. Open your hand. What is that object?
Bottle cap.
Yep.
It's a jar or glass.
Yep. And one more.
Some kind of coaster, maybe.
Yep. Okay. That's sensory function is intact. Next, I'll be drawing a letter or number on your hand, and you got to tell me which one it is. Close your eyes.
J.
Yep.
1.
Yep.
R. R.
Okay.
C.
Yep. Kapphresia sensory is intact. Okay. Next, what I'm going to do is I'm going to touch a spot on your body, and you got to touch that same spot. Okay?
Okay.
Close your eyes. Okay. Diagnosis is normal. Next, I'm going to take control of your arm and I'm going to move it up or down, and you got to tell me which direction I'm moving it, okay?
Okay.
All right, close your eyes.
Up. Up. Down. Up. Up.
Okay. Next, we're going to do it on the other side.
Up. Down. 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 Up.
Kinesthesia sensory function is intact. Next, can you lay on your back for me, please? Next, I'll be assessing your abdominal portion. All right. I'm going to start by inspecting for the contour and symmetry of the client's stomach. There are no bulges or visible pulsations of the stomach. I'm going to start by auscultating in all four quadrants, starting at the upper left quadrant, listening for any bowel sounds. Bowel sounds are active in all four quadrants. Next, I'm going to percuss all four quadrants. All quadrants are tympani except the upper left because of the liver, which is a dull sound. Next, we're going to be testing your hip range of motion, okay? Range of motion bilaterally is intact. I'm going to pull your leg out and you got to resist me, okay?
Okay.
And the other side. Next we'll be checking your ankle range of motion. Range of motion normal in right ankle and left. Can you resist against me pushing? And this side. And this side. And go that way. Pull towards you, to your nose. And to your nose. Okay. Can you point your toes forward and back?
Yep.
Okay. Strength and range of motion in toes are intact. Checking the ankles and feet for any edema or swelling or abnormalities. No pitting edema in ankles bilaterally. Hair distribution on both legs is normal. Cap refill on each foot bilaterally is less than 2 seconds. Cap refill on each great toe bilaterally is less than 2 seconds. I'll be checking your dorsalis pedis pulse bilaterally. Present and strong on the right foot and the left foot. I'll be doing the posterior tib pulse. It's present on the left and present on the right. Okay, I'm going to be checking your Holman sign. Let me know if there's any pain or discomfort when I'm pressing your ankle back. No?
No. No, nothing.
Any signs of DVTs would be swelling and redness and pain upon a positive Holman sign. Okay. You can sit back up again. Can you resist me pushing down? And me pulling up. I'm going to pull up and resist. And push down. Okay. Can you extend your knee for me, please? Kick out. Okay. Flex. Kick out. On the other side. Range of motion bilaterally is normal. Is good. Next we're going to do the patellar reflex. Reflex on the right is normal. And is normal on the left. Next we'll be doing the Babinski sign. What we'll be looking for is flaring of the toes, which is a positive sign, which is abnormal. Right side is normal, and left side. Can you stand up for me, please?
Yep.
Stand up straight. Okay. Body posture is normal, no signs of lordosis or kyphosis. Spine has the normal S shape. Can you walk towards the camera and walk back, please? Yep. Client shows good gait and range of motion when walking. Can you walk heel to toe for me, please?
Sure.
Client shows balance when he was able to walk heel to toe. Can you walk backwards, heel to shin? Like this.
Okay.
Client is able to maintain balance from heel to shin walk. Can you close your eyes for me, please? What you're going to do now is hold your arms out to the side and then touch your nose alternating. Motor function is intact. Towards the window, please. All right, can you bend forward and touch your toes? Spine is straight and intact. No abnormalities or protrusions of the spinal column. Can you like this for me, please? Rapid alternating motion is intact. Okay. That's it.
Thanks.
No problem. Thank you for meeting with me today.
No, thank you.
Have a good day.
You too.